our seventh episode, Know Thy Health. Today, we want to talk about math. Alex always says it's just math, and he's right. I've started using this statement, Alex, thanks to you, like in everyday life. My wife will be, you know, talking about something or maybe complaining or asking me a question. Like, it's just math.
It's just math.
Talking to some friends the other day about uh, them transitioning to health insurance or individual health insurance plan from their employer plan. And I said, it's just math. And so we want to talk about math. We had a previous episode, Alex and we talked about some healthcare hacks, some ways to save money. And that's not what we want to talk about here today is, the hacks at kind of an individual level, but we want to talk about some of the creative opportunities and the solutions that we could start thinking about and implementing at really at a high level, at a regulatory level, at a carrier level, to make a big difference on the consumer and on the employer's health insurance. So we've you know got no shortage of topics to talk about, but we want to keep this focused on the solutions, the big solutions. We can call them hacks, but they're at a much larger level, kind of just beyond us. But we have uh, we have some data here to share, and then also just want to have a conversation around what we can do to make a difference. Let's dive in. I think Daniel's got some things he wants to share to get us started.
Yeah, and Cameron, if you want to put up the graph on the screen here, we can start with well, first there's I think three ways to get people to not watch your podcast video is like first tell them it's about math, second get an actuary to start speaking, and then third is pull up a graph. I think people we might have some low viewership, we'll see, but it's really important. I think this is one of the most important graphs that I think Americans should understand, especially policymakers, but also just your average voting American. And what we're talking about today is the difference between a health hack and a health solution. We'll kind of tease this out as we go, but like a health hack is really how you and your family can save money in our current system. And they're super relevant, super material for your family. There are a ton of health hacks in today's marketplace that can save you thousands of dollars, and they're wonderful. So we're not saying that that these don't exist and they're not good, but it's different when you start talking about healthcare solutions. Now, when I think of a solution, I think what are things that we can do to change our current healthcare system so that we have a healthy system for our kids and our grandkids 10, 20, 30, 40 years from now, and something that will actually materially change our system for the good. And so that's what we want to talk about today. Before we get into this wonderful graph that we're going to spend the whole conversation on, um, I'm always reminded when I think about healthcare hacks, I'm reminded of a roommate that I had back in the day, a fellow actuary. I won't name who it is. And he was like obsessed with like extreme couponing. So if you remember, they had like shows like where you can like extreme couponing at like grocery stores. And I remember one time he came back from Vaughn's and he had like 7 gallons of apple juice. And he was so excited. He's like, dude, I just got 7 gallons of apple juice for $1. Right. And like it was just like an insane thing. I was like, we're not gonna drink all of this apple juice. Like, what's the point of you even getting this? But he was super jazzed about just the fact that he could do it. Now, that's an extreme example of I think sometimes the things that we see from people presenting health hacks in healthcare system. It's an extreme example because it's irrelevant because it's apple juice. But what I always thought about with this kind of story is like it's true that you can get 7 gallons of apple juice for $1 in that current like weird couponing environment. It'd be ridiculous for him to come to me and say, I think I found a solution for all Americans to get cheap apple juice. And it's easy to understand in that analogy, like, because like obviously if everybody started extreme couponing for apple juice, like Vons would shut it down and be like, yeah, we're losing money on apple juice, right? Like this is crazy. But as long as like it remains a small percentage of people that do that, like they'll have the weirdos like my roommate who will get the 7 gallons, but they'll have the normal people that will kind of like find some use in these coupons and find a little bit of savings, right? So that's the backdrop of kind of how I want to tee off the difference between health hacks and healthcare solutions. This graph is going to really help you visually understand it. And what's cool is we got healthcare experts here to just like react to it. This is a graph that I've made. I've been making this graph for some years now in the actuarial community. And so this is going to be fun to just get their reactions to how this can help you understand our healthcare system as a whole and the difference between solutions and hacks. So the first thing, just to orient yourself to what we're looking at here, this is 2023 California hospital data, their revenue data, and it's split by different markets. So whether it's, this is now the x-axis at the bottom, whether it's between Medicare, other, Medi-Cal, which is Medicaid, or private insurance.
What's other?
Other
What, give me an
is,
example.
it'll be a mixture of like your county plans or your cash
Oh,
pay
okay.
people, your uninsured, kind of like this like kind of catch all other. It only, we'll get to this, but it only represents like 2% of their total revenue. But it's useful to kind of look at. So the first thing is hospitals have a bill charge, meaning they actually have a charge master. Think of this as like if you go to In and Out, they tell you what does a hamburger cost. It's $3.25. You can see it on the menu. Every hospital actually has like a charge master that has rates for all the services that they perform. They also have something called a cost to charge ratio, which is what percent of that charge do they kind of break even? Okay, so that's that orange line. You can see it's a weird number. It's like 24%, right? So if they charge 24% of their charge master, they break even. So the simple thing to understand is that orange line represents the break even, meaning everything below that orange line is a loss for the hospital. Everything above that orange line is a profitable um, service for the hospital, or in this case, like high level market categories that are actually profitable for them. So just think of that orange line for a moment, just as like that's where hospitals break even. Below is loss, above is profit. So the first thing to understand, or the first thing that I draw from this graph, is to look at how different the actual profit and loss is between what type of patient walks into a hospital. If you have a Medicare patient that walks into a hospital, Medicare being, 20 to 25% of our population, the hospital is making a pretty significant loss on every single service that they provide there. So, what do they have to do to make up for, say, a Medicare loss? They're obviously not just going to take losses forever. They have to change the rates in a market where they can change the rates, which is your private insurance on the far right of the graph, which you can see is over 2 times. They charge over 2 times what they charge for a Medicare patient, so that every single patient that comes through the door from the private market, now private market is your employer-based coverage. If your employer has insurance, they're in the private market. That's half of Americans. Or if you're on Obamacare, which is like 20 to 25 million Americans. And so the first thing to understand about what's happening in our healthcare system is, let's just look at hospitals, which is like, 40 to 50% of all of our healthcare costs. They are in totality making, in California at least, about 1% profit margin, not like an extreme profit margin. They're about 1% operational profit margin. And they have to deal with the fact that federal run programs like Medicare or Medicaid force, they kind of tell the hospital what they're going to receive for a service. And all of those are usually below their cost to charge ratio, that orange. And they're making a loss on those patients. And so they have to charge everybody else a significantly higher rate to balance out that that cost, and so that they can make just a marginal profit overall. So first takeaway, um, when we think about what's wrong with our healthcare system, we have to acknowledge that we have a centrally planned, socialized, price controlled market that drives almost everything that happens in healthcare. It's called Medicare. Medicaid is kind of like a similarly price controlled market. And just to give you a sense of the scale of this, um, in terms of just looking at like the gross revenue, the bill charges, Medicare accounts for 40% of all California revenue in this graph, right? So when you have that level of market distortion, it's going to radically impact all other markets. So that's kind of takeaway point number one. We have a situation that we have uh, federally run payer system. So when you start thinking about like the private insurance market and your employer and everyone else saying like our costs are rising, like you're usually talking about the people that are in that 35% number right there, that very large thing. And it's easy to say like, oh, like the hospitals are making a killing off of us. It's way above that orange line. But that's not taken into consideration that from their lens, they're just trying to somehow balance this bizarre budget. Uh, the second thing that I think is I don't know. The second thing that's interesting to note from this is like people when you talk about healthcare is broken, they usually highlight a couple of things. They highlight the cost. They also highlight like how crazy the prices are, just how like insane the prices are. Like it doesn't make any sense to anybody. And I think this graph kind of brings that out. Like going back to like in and out, it's like if like you walked up to the menu, it's like show me your menu in advance, and they give you a menu and it says like our cheeseburgers cost $20. And you're like, what? $20? And they're like, no, 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 no. Actually, it's not really $20. Like, it's actually $5. And you're like, what do you mean? Well, it depends. Like, if the federal government's paying for it, it's actually like $3. But like, if you come with your own credit card, it's like $4. And if you have like your insurance plan pay for it, well, that hot hamburger is $10. And they're like, well, why'd you even tell me it was $20? And it's like, well, like when we started, we had like a price sheet, and then like the government got involved, and we like somehow we had to tie things to something, and like, but it's been 50 years and we're not really sure why like we say high hamburgers are $20. So even that was probably confusing as like an analogy, but like just to say like how crazy our system is, like we have rate sheets for hospitals that are totally irrelevant. Like the discounts for Medicare are 85% discount off of the rate sheet. It's like, why even have a rate sheet at that point? Or like private market is 65%, right? And so like a couple of funny things that I think come out of this is like you'll get people in, like I've seen this in the health share world, that'll like they'll count that as somehow like savings that they've brought to like their members. They'll be like, we saved you 50% off your bill. And you're like, nobody pays. Like everybody saves 50%. Blue Cross saves you 60% actually. Like it's like it kind of, so one, it confuses Americans, but two, it allows for, I think, people to distort things when they talk about healthcare because it's so crazy and wonky. And again, the reason why I put this graph up is to like just point out that like things are insane in healthcare, but like the people coming up with solutions often just point to the insanity without like kind of going back to like the first principle of you really should look at that Medicare number, and you should probably just stop at that Medicare number and say, holy smokes, what do we do about a system like this? Because nothing makes sense as long as Medicare is forcing hospitals to take a loss every single patient that comes through the door, if that makes sense.
Yeah. And Daniel, just to add on to your percentage discount, I think it's almost like the institutionalization of Americans, right? Where we've just been trained to think about health insurance specifically. Like you would never think of your car insurance or any other type of insurance as a percentage, right? So what percentage of my car accident are you going to pay? No, you're going to pay a certain amount, right? And I think a lot of it goes back to insurers in the employer space. What, like we were talking about the other day about how HR departments shouldn't, like employers should not be in the healthcare space, right? How in the world healthcare or employees or employers started having their HR departments manage people's healthcare is insanity, right? But I think as that grew and expanded, I mean, these HR departments, they're responsible for hiring, firing, discipline, I mean, benefits. I mean, you name it, right? And so when the one time a year that a Blue Cross or someone comes in and sells them a product they're just institutionalized to think, oh, the larger the percentage savings, the better off we are, right? And so, and you can't blame, Jim or Sally or Joe or Susie or whoever is in charge of that, because there's so much on their plate. But it's a very easy thing for them to process because they've done it for the last however many years, that the bigger the percentage savings, the better. Right. So it's just an interesting, again, how we've been institutionalized to think in that context with health insurance.
Yep. So I wanted to jump to like the cash pay too here, where like this isn't, you kind of asked Cameron, what does the other category mean? And like, so that 17%, it's pretty close to Medicare there. Like it's not, this isn't just representative of cash pay. There's a kind of an aggregate of things in there, but I think it's a good symbolic representative of where cash pay plays into our overall healthcare system, which is like, all of the three other categories there, Medicare, Medi-Cal, private insurance, accounts for 98% of the hospital's revenue here, right? And so this is back to the apple juice analogy. Like there's a 2% like category where the hospital, like this is not their bread and butter. They're kind of in this like space of do we write off business for uninsured people that show up to our emergency room? Do we have people that are asking for cash pay prices for this and that? And it's not really relevant to their bottom line. And from their perspective, what falls out of these big three categories, they're kind of happy that it's 17% and not 0% is one way to look at like the marginal cases. So you're going to have people that show up to the emergency room and it's like, if you don't have insurance or whatever, like, and you can pay like 5% of the bill charges, like the
Something.
hospital's like, it's something. They're like, okay, cool. Right. And it's the difference between, and this is where I think the cash pay world, which I've been invited to some of their events. I try to understand what they're talking about. This is where like you have these people that are not really experts in the healthcare is what I've seen. I've seen people that have like personal experiences in healthcare where it's like, whoa, like I like paid for this one surgery like out of pocket and I saved like 50% on my bill. Like that seems crazy. Like, why don't we build a system around that, And it's true that you can do that. And it's true that like it makes a material difference for families. And there's a way that you can really save money in today's healthcare system by kind of being smart and knowing that the system's broken and knowing that there's people out there that offer things better than your like just standard normal way of doing things. That all of that is 100% true, but it's not true that that's somehow scalable and replicable on a global scale. That's something that we as Americans at the state level or at the federal level as American voters should be promoting as somehow a healthcare solution. Because as long as that number is low, that 2% of people who are accessing that near Medicare rate, hospitals are fine. But if that number went up to 5%, 10%, if everyone again was buying apple juices off the shelves like crazy for $1, like eventually it would be put to a stop, right? And so I think the big thing for that this communicates to Americans and policymakers is the question of materiality. What is material and at what level? So health hacks for Americans are 100% material for the family and individual. It makes a material difference. There is going to be a real impact, and you should pursue those. But when you take it to the state level or to the healthcare system level, it's immaterial. It's an immaterial thing to talk about, and it's a waste of time. And so one thing, and the reason why this is, important for me, it's something I've spent, 10 years working in the policy world at the federal state level prior to Presidio, is like, you should care, like, as you as an individual, an American, you should care. It is material to you what the healthcare system looks like 30 years from now. It's material to you maybe because you'll still be alive in 30 years. But I think what's more important as a father is it's material to us as Americans what the healthcare system is going to be that we pass on to our kids and our grandkids. And we're the last modern country that has avoided the single payer system, essentially. And all of this graph is pointing to is putting pressure and pressure and pressure on us to move to a single payer system. Because think about like think about like people who will weaponize this in one way. Let's say the Medicare for all people. The temptation there is like, well, look, Medicare is so much more efficient and saves so much more money than the private market. If we just moved everybody to Medicare for all, we would have, incredible savings. We'd save the healthcare system tons and tons of money. And like they can point to real examples where that's true. But the flip side is like
Well, and,
Medicare's
and you're running into your free market piece too. I think, we had discussed this, earlier, is it still goes back to supply and demand, right? I think, it's to send all of those people to the same facilities and the same doctors. And at the end of the day, there is a limited number of hospitals. There's a limited number of providers, whether it's neurosurgeons or orthopedic surgeons or OBs, GYNs, or whatever that is. And I think that's the hardest part about it, right? Is this balance and this matrix that's been created, that we're looking at this chart we're looking at, right? Like it's been a tailored, massaged, I guess, flow of patients and dollars that have just kind of evolved over what, 30, 40, 50 years, right? And to make any drastic changes or to move things and move those buckets in any significant way to the left or the right there, it throws the whole car out of whack, right? And so that is the interesting part is and it's funny because I even like the nonprofit, like you're talking about these hospitals where they work on such small margins, and yet we will drive. I mean, just like I just get a kick out of you and Bob when you're having your babies and you guys are picking the facility. Which of you is picking the facility that has like the ocean front view? Oh,
Yeah.
yeah, and right, and like, I mean, I look at these hospitals there's one I drive past when I'm driving on 95, and it's got so much glass, and every time I drive past it, I just tell my wife, I'm like, yep, there is our insurance money at
Premium
work,
dollars
right?
at
These
work.
hospitals, they're always building a new cancer wing. There's a new whatever wing, and there's so much money, but it's such a finely, I don't even know if finally is the right word. It's just a very developed infrastructure, right? As it exists. And like you said, Daniel, there's not maybe a ton of margin in certain buckets, but collectively, obviously, it's a very profitable space that just takes I don't say profitable, it takes a ton of money to keep it running. And I think at the end of the day, we look at this and we say, well, we can't afford for it to stop running, right? I mean, if our car breaks down, you can take it to the shop. You can, hey, it's good. We're gonna maybe have one car, you and your wife, for the week, right? Hey, we got to kind of put things together, piece it, get rides, do whatever we're gonna do. But if the healthcare system shuts down for a week or a month or a year to reorganize it, I think it just blows their mind to think about what kind of consequences could come out of that reorganization, right? And so it's just a hard space with so much money. And what is it? 1/6 of our economy. We talk about,
trending to 1/5. Yeah.
yeah, I mean, trending to 1/5. And, you know, I've had some friends and I've said to them, I said, explain to me how we shrink 1/5 of our economy and not go into a recession or something. Like we're worried about, flat quarter over quarters. Look at the market today. I mean, the market this week is just with the tariffs has just been kind of a mess, and we're dealing with trending towards 1/5 of our GDP. That is just such a massive piece, right? To move and massage and move into different buckets. It's right. It's part of this journey we're on as a group. We're sitting here is we've got to start solving this problem. And it's not just like that. It's not just a health hack for a single family. We're going to do a ton of that. But how do we start creating products and pieces that give people flexibility, give employers flexibility, give people, control back to how they use that resource, right? Just be interesting. And it'll be an interesting path and journey that we're going to go on.
there's, well, is there a green line we can put on here, Daniel, that's for like profit margin of these hospitals? That's the cynic in me, right? Like,
It'd be yeah, it'd be like right above the orange line, the green. But again, the scale, like what Alex said, let me be clear. Like, I mean, you're talking a $5 trillion industry. Like 1% of 5 trillion is a lot of money. When you talk about percent, it's one thing to talk about percentages, but it's also like percent of what? Like these are massive, massive, like these insurance companies are, hundreds of billions of dollar valuations, right? So you could get like a 20% profit in some market that's like very small, but so
Yeah. Well,
yeah, I don't.
that was the other thing about the markets, right? Where we talk about the complexity of just everyone says, well, how much does a hip replacement cost? Well, part of my answer to that is, well, I don't know. Are you in Los Angeles? Are you in Albany, New York? Are you in Miami? Are you in Sioux Falls? Like, I don't know, like every market. And it's just like back to your hamburger example is I wish we could go and have a list and say, hey, you know, a knee replacement or an ACL repair, it's going to cost between whatever, say $5,000 and $6,000. But you go to all of these different markets, and it's unfortunate. It's not like buying a gallon of milk, where it's going to be roughly maybe a little more expensive over here, a little less expensive over here. The market factor just changes how much healthcare costs, and you get these crazy charges. Like obviously, New York, it's going to be way different in New York City than it's going to be in El Paso, Texas, right? And then there are places where that doesn't play into the game either. Also, there are some rural, small, middle, and nowhere places where there maybe is no competition, where the charges, just like the Medicare rates, rural facilities will sometimes get a bump in their Medicare rates because of where they're located, right? It's just it's such a complex market.
Yeah. Well, you hit on kind of the I think it's very in vogue to talk about price transparency, right? Like, how do we get people to like shop on price and like make this convoluted process a little bit more transparent? Like, I think the thing is, like, all of these things are well-meaning and good, and they would function really well if upstream we actually had a free market. I think that's the
if it
missing link.
mattered.
Like, yeah, like if yeah, if it actually mattered to be able to shop for care that would impact the global system, like it would actually do something outside of being a health hack. But it's that upstream issue of the Medicare, the Medi-Cal, the fact that your employer buys coverage, the fact that you don't actually shop, that's ultimately causing the problem. And you said something interesting, Alex, that like it's hard to move, like it's hard to change the status quo. I think one thing I like about the cash pay people is like they're at least trying to innovate, they're trying to figure out something, they're trying to make things work. But it's really, really hard to change the status quo because people are making a ton of money based on the status quo. So like the only people that want to change the status quo are innovators. Because like if you're making
Any money yet?
yeah, yeah, like we like us, we want to make this we want to change the status quo, right? Because you want innovators to like we want to knock the people off of the horse that are currently profiting off of our current system. But there's always this challenge where it's like the person that's the big king, the big gorilla in the room, like they benefit from the status quo. They have all the money, they have all the lobbyists, they have all the power.
Yeah.
And that's why like Americans should really like we all know this. We just need a reminder about this, that like the beauty of America, the beauty of free markets is it allows innovators to knock that guy off the horse because they don't want to get off the horse. But at the end of the day, if you had a better product that's cheaper, it doesn't matter who has all the pockets, right? It doesn't matter if you're a Blockbuster. Here comes Netflix, they're going to bankrupt you, right? But the difference when you don't have a free market system is that the people aren't impacting the innovation in the gorillas. The gorillas know that they can lobby the government, they can go to DC and they can make sure that legislation's in their favor. They can have big lobbyist groups at the state level to make sure that like their product and their people are the ones that stay in control. They can go after the innovators and like kind of, and they can go even to the, you know, the big employers and all of this. Like they can do all this because the individual family and the free market is not actually driving innovation. And so again, like we have to fix, we have to make it a free market system if we want to save it. Otherwise, the it's going to just get more and more centralized and single payer. If the federal government's controlling everything, well, guess what? Those gorillas, it's easier for them. Instead of them having to have lobbyists at the state level in 50 states, I only have to send my big lobbyists to the central federal government and impact whoever is on that committee that controls the entire nation's healthcare. That
But
that
even the free market side of it though. So my first job in healthcare is I worked for a spinal implant distributor in Gainesville, Florida. Right. So here I am coming out of my little sporting events thing that my playtime that I got to go do as an adult for a little bit. Um, and I learned something real fast. So spinal implants. So we had orthopedic spine surgeon and we had neurosurgeons. And I was at the University of Florida. And so what I learned is that they had the residency programs at the University of Florida. Okay. Highly competitive for neurosurgeons and orthopedic spine surgeons, the residencies, because there was a ton of money to be made if you were accepted into that residency program and then you were sent out into the world to go be a spine surgeon. Probably outside of maybe like a cardiothoracic surgeon or something like that, probably one of the more profitable um, surgeons you could be. So what I saw happen was the University of Florida and those programs dictated by the national level organizations of these specialties, like the National Orthopedic Societies, all of these different groups, they would limit the number of residents that they would allow to come in every year. And the reason they did that is they wanted to ensure for the profitability of their trade moving forward that once you graduated from residency, and you could do any doctor, right? OBs, pediatrics, I mean, you name it. They limit the number of people that can leave that program. That way, when they go out and they go to wherever they go, there will be enough business for them to not only thrive or not only pay their bills, but thrive, right? And so the free market space, I mean, just to stay in your hamburger analogy is way better than you're giving yourself credit for, right? So if I'm hungry and I'm,
Great
you
right now.
know, yeah, and I'm driving around, I have a Wendy's, I have a McDonald's, I have an In-N-Out, I have multiple burger sandwich places that are all going to relatively give me the same type of thing. Time is going to be relatively the same and cost is going to be relatively the same. When I have a herniated disc in my neck and I can't sleep and I got to walk around like this so I can feel my fingers. I don't have the luxury of going to multiple spine surgeons to have it looked at, right? Like typically I'm going to go see the very first guy who will get me in, who is qualified to potentially solve my problem, right? And there you go back to the limited availability of those people. I might go see the guy that's a year out of college or the year out of his residency. He's not very experienced, but my option B is I've got to wait 3 more months or 4 months to go see another spine surgeon. It's just not a tenable situation in that moment, right? And so when you start thinking about the dynamics, and maybe it's not a free market, maybe that's why the cost, then people can dictate it. Where as Americans, we want to sit here and this is the United States of America. Dang it, we're capitalists. This is a free market where it's a free market with all sorts of cloaks. Like you said, just some very big power players behind the scenes pulling the levers, right? And so I still go back to, why I know we said we were going to not bring it back to Presidio, right? We were going to stay at but just like the
Bleep it out.
like return it's to me the answer is always returning the power to the people, right? Like
Yes.
The people need the power. Like you as a husband, as a wife, you should be empowered, and you need to have as much power in your hands as possible to make the best decision, because your decision in LA is going to be different than your decision in Gainesville, Florida, right? Or Albany, New York, or wherever. And we want to create products that give you as the consumer as much power as we can. And collectively, hopefully, we gather like-minded individuals that move from just power back to you to a true movement to potentially start changing these things at the federal, start the state to the federal levels, and restoring, because like I said, free trade or free markets, it's hard, right? When there's limited doctors, when there's limited hospitals, there's limited, and then you start seeing the vertical integration of these hospital systems. So these giant hospital systems, HCA, you probably have heard HCA in the news. That was like Rick Scott. Rick Scott got hammered because he just made so much money, the senator in Florida. And then you've got, oh gosh, I mean, Tenet, I mean, is another big one. There's just a bunch of big ones. So a few years ago, those hospital systems said, well, what we're going to do is we don't want any of these little free market people and things out there competing or creating competition for us. So what we're going to do is we're just going to vertically integrate this whole thing. We're going to go hire primary care doctors. We're going to buy surgery centers. We're going to buy imaging centers. We're going to hire the neurosurgeons, the orthopedic surgeons, the labs, everything. So that when we dump you into our system, our last podcast, we talked about the conveyor belt, right? Like we want to create a conveyor belt that you just keep your mouth shut. You go to the next step, and that next step is always going to be inside of our hospital system, billing every single step along the way. And it's like, so you've got, and like you said, you're dealing with major power players, billions and hundreds of billions of dollars. One of the big kind of things out there right now are surgeon-owned surgery centers. And so it's a big piece of kind of that cash pay bucket, right? Where what they do is they offer really good pricing, kind of out of the gate, and they try to build a book of business, right? And you got to ask yourself, what are these surgeons like? Why are they building this book of business? Are they building it to offer better pricing and create a better opportunity? Well, they said there's only 2% cash payers out there, so it's not really that. What they're
Well,
doing is they're building a book of business to become a big enough of a pain or a profit center that the big hospital system down the street says, you guys are big enough now. What we're going to do, we're going to write you a massive check for that surgery center. You guys are all going to stay on board for the next 3 years. Keep all of your business there. And they basically just integrate that into the hospital system. And these surgeons who are good businessmen just make a ton of money, right? And they cash their check, and they provided a great service. I'm not knocking it. Like, good for them. They have a skill that they should do it. It's just, man, it's like free markets are hard in this
what's
situation.
I have a question on those, because I was wondering this, like those surgery centers that are able to offer the cash pay,
Mm-hmm.
is it part because they don't accept Medicare, Medi-Cal, stuff like that?
No, so
Or
they,
Medicaid, Medicare?
yeah, so what you have is when you get these cash pay centers, is the big thing is the Laser Spine Institute is a big one down here in Florida. And they built that cash pay model. They also accept insurance, right? So what they basically it's all marketing. And once you get into their system, they bill whatever is the most profitable thing. If it's your insurance that you have, whatever you have. And then on top of that is Medicare. I think, Daniel, I have a surgeon buddy of mine who's a good friend of mine, great businessman. One of those guys that breaks the mold of a doctor and a businessman, right? And he will tell me all the time, he says, Alex, I can make money on Medicare patients. He goes, you just have to be disciplined enough. You have to run an efficient enough business. And I think what happens is medicine there's so much money in it for the providers, and there are so many insurance people, it allows them to be inefficient in how they run their businesses, right? And so then they get a Medicare patient in and they're like, well, I can't make any money on this. My time wasn't worth it. Well, no, the problem is you're comparing it to all of the insured patients that come through your door, all the workers' comp, all of those big cases. And if you ran your business really efficiently, and again, you don't have a big fan, like, what do you need? What do you need a fountain in your, what's with all the glass in your office building, right? I mean, this surgeon, he has a very basic office and he's there to serve people and do it really efficiently. And so I think there's a combination of it doesn't pay as well. And therefore to them, they've kind of built their business on that level of insurance dollars. And then when they get one here, they say, well, I'm not making any money on it. Well, you
Yeah.
could if you just did it really well.
Yeah. And the
What
Medicare,
if we?
go ahead, Cameron.
No, you're fine. Finish that because I might change the subject a
Yeah.
little bit.
Yeah.
But
No, I was just saying like the Medicare. Yeah. And I want to be clear, like I put up a graph that's like an aggregate of all hospital services combined and it's facility fees. And it's just math. It turns out that private makes 2 times Medicare. You don't have to be a math genius to know that like the more private market patients you get versus Medicare and that ratio, the better, right? But when you get down to like specific services, I think some I'm sure like are better than others in Medicare to what you said is like, like definitely there's probably areas where like that might be a good benchmark as what's efficient.
Well, I
Again,
don't, and not to like, but cash pay can be deceiving as well. Unless, I mean, I've done thousands and thousands of cases, so I've seen everything. I always say the cash pay at a surgery center, oftentimes it's like a car dealership, right? So you go buy your car and, oh, do you want a steering wheel with your car? Do you want tires on it? So the surgery centers, even if they're cash pay, they want all of the add-ons that they can add on as they go, because there's a CFO and a CEO that runs that organization. And sure, the cash pay price may get you in the door, but if you let them add on 15 different things for another 20%, they'll absolutely add them on for you, right? And so that's that's where the capitalism free market piece. It's a free market, right? You can go wherever you'd like. Sure, this is the cash pay for the surgery. That doesn't include the implants. There's a famous one out there, a big one. I won't say it because I don't want to get us in trouble or whatever. Their implants aren't included in the surgery. Like you get a total knee replacement. Oh, and your overnight stay is not included either. Those are two pretty significant pieces that, yeah, you're getting the doctor, you're getting the procedure, but your implants, $8,000, your overnight stays, $5,000. All of a sudden you're basically at a premium insurance rate at that point.
yeah, but I mean, I like the a la carte play. I mean, might as well get a colonoscopy while you're at it. You know what I mean? Like, hey, while you're
But that's, I
fixing my
mean, it's a
broken
good
arm, can you?
going back, and this goes back to pricing transparency, right? And I think what we're sort of beating on here is I've heard a lot of like free market principles, right? Free market only exists and only benefits when we've got pricing transparency and the supply and demand can be adequately matched, right? And if you go back to, if we pull that original graph up that we had on the screen, you look at where the Medicare rates are versus private pay rates, and think about, we've got the Federal Trade Commission busting up monopolies, right? Antitrust laws all over the place, vertical integration, horizontal integration. But you talked about integrations of these major health systems. That's only, I mean, when we think about who comprises the payers in this space, we've got a couple of big payers, but they're dwarfed in comparison to the federalized, centralized markets. Medicare, Medicaid is making up 30 to 50% of hospitals' revenue, right? So think about, again, like Daniel, you said, we've got the last, in the Western world and developed countries, we're probably the last truly free market system, but like barely in terms of our healthcare system. We're moving quickly towards a centralized healthcare system. What are some solutions that we can think through that actually help? Because when we're playing in this cash pay space, we're playing within these very small margins that really don't actually make a difference. Where can we see where maybe price transparency, other sort of solutions that actually can make a difference, because we're barely holding on. I think as long as we're in the minority, the private pay is in the minority of hospital compensation, it's going to be very hard to make a change in the system.
The end game for, a Daniel in the free market, right? Like the innovator is like where change comes. And so you look at like Amazon, right? And we know what Jeff Bezos built. Like the true innovation there, like changed how consumers buy and shop and receive widgets. I could get on that right now. There's stuff I can get by 5 o'clock today, right, to my doorstep. Um, if we like, if someone would have told our grandparents, when they were our age, right, like, oh yeah, if you just get on this, you can just click this button and something will be on your doorstep, their minds would have been blown. Uh, but that's the reality we live in because of an entrepreneurial spirit and innovation. And I think you have that at a starting point in the healthcare space, whether it be on the delivery side, whether it be direct primary care clinics, whether it be cash pay surgery centers, insurance companies, you name it. It could be, online therapy, telehealth. Like there's so much innovation that happens, but there's this system that's built. The typical end game is if there's traction and you've raised capital, then you now have proven traction. The entrepreneur is then cashed out by private equity, is typically or receives a growth round of funding from private equity who now controls. Private equity has all of the relationships and connections to the systems and the payers, and continues to grow that business until it's then acquired by like a system or a payer. And it's now absorbed in, to the point we were making earlier, right? Like these surgery centers, provider groups that go out, they get a critical mass of patients, and then guess what? The local big hospital system gobbles them up and pulls them into the fold. So I
Or
wonder,
or private equity. It's the same model with private equity too. Like it's just an acquirer, whether it's a health system or a private equity group
right,
buying
right. But
the
private
practice.
equity's looking to flip that, in 3 to 5 years. And who are they going to flip it to?
Private equity company, then another private. It's a hot
That
potato game.
or a health or a payer or a healthcare system, right? And so, those are, or an insurer like United, United Healthcare, Optum, they're buying, digital health companies left and right. And that's no issue, but they're the ones, they can then control that innovation that has happened. They either now own it or they can sunset it, they can eliminate it from the market, they can roll it into their fold. And so, this is like crazy, but instead of subsidizing the cost of care, what if we subsidized the innovator, as like a solution? Like if you got like the, huh?
Who subsidizes the innovator?
Well, like the centrally planned, like, right, the government,
Federal
or is
government?
there a way? Is there a
Elon?
way to
Elon subs.
Sure. Like, is there a
Yeah.
way to, I guess what I'm thinking is like, is there a way to incentivize the innovator to keep innovating, versus, you know, their hand being forced to sell to, and I don't fault people. Like that's an exit. Like that's, you built something special, you have an exit, you can now go on and do the next thing. But in this market of healthcare, um,
But you need more. I know, Daniel, I know you're biting at it. I'm like not nearly as smart as you, so I got like my thoughts in a row here, so I got to like get them out before I forget them. But it's got to be more than money. And I'm gonna go back to why Presidio, why we are going to gain market share is one, you got to there's not a place to you can't subsidize everything. You look at at employee funded plans, employer stuff. You look at the Obamacare, the ACA, they subsidize everybody else, right? The healthy people subsidize the non-healthy people. At Presidio, so we're going to have some, by nature out of the gates, like we're going to have some pre-ex exclusions, some knockouts. We're not going to subsidize all of the unhealthy people. The second side
mhm.
of that is margins, right? I think with no deductibles, no copays, we are sacrificing margins so that we can offer value to people from day one. And Bob, hopefully this is answering your question, like, how do we change it? And then the third thing is it's got to be more than money, right? I think at the end of the day, very few people go into healthcare out. Well, and I would say maybe the only people that go into healthcare are doctors to do it more than money, right? Everybody else, pharmaceuticals, I mean, construction, you name it, like they're doing it to make money. Is we care about life over and above everything else, right? So I think you have to have a reason to serve your people that doesn't involve just money. So if you remove Presidio, we're not going to subsidize an unhealthy lifestyle. If you're just a grossly unhealthy human, I don't mean just like overly unhealthy. Grossly was not probably a good choice of words, but if you're an overly,
We love you. We want you
we
to,
love you.
improve your health.
Well, like we said, Presidio's not the right program. It's not the right insurance program for you, right? There is the Affordable Care Act out there is for you. Margins. We're sacrificing margins, like I said, to offer more value to you as a customer. $1 value, right? No deductibles, no copays, a $5,000 bill out of the gate. We're splitting that with you right away. You're going to get value on $1. And then we are doing this to preserve life and to maintain the biblical direction that we've been given by the Bible, and how we care for people, how we live our lives, and the profession that we're choosing to promote and serve people with. And so I think when you combine those things, like there has to be some give. I always say it's like the US healthcare system it's speed at which you receive your treatment, the technology, basically the advancement of what you receive, and the cost. Those are the three things that dictate care in this country. And you can only have two of them. So if you want it fast and you want the best technology you can get, you go to all these other countries, if that it's cheaper, you're either giving up the technology you receive or you're giving up the speed at which you receive it, right? And so Americans, no way. I want the best and I want it right now. Okay, it's going to be really expensive then, right? But no, I think
Trade-off.
you get the subsidization out. The
Well, you're
margin.
talking
Yeah,
about
and
federal.
I'm talking about like and maybe subsidization is not the right word. Incentivizing the innovator to keep innovating and not exit to the companies that have all the money in the world and control everything and have us in the situation we're in, right? And so that's a really big problem to solve. But like what you explained, Alex, is like there's a lot of virtue in that. But you know, like you're building like the most innovative, telehealth app that's for the most marginalized communities, and you've got all this VC funding and you're burning cash and you're building and building, and then one day you wake up and like you've got critical mass and you've been working at it for 5 years as an innovator, and next thing you know, Optum comes along and is like, here's a few $100 million, and you're like, well, I really care about this community, but I also didn't realize like you know, now I'm going to have $500 million in the bank. And so, like, what's the incentive for me to continue on? And so it just makes me think, like, is there a way there where we need to incentivize like the world's best and brightest to come solve the problems in healthcare? Elon says this all the time, but he's like trying to put people on Mars. I mean, we have the best and brightest people, and we have a free market that funds the best and brightest people to go put us on Mars. Like, what if we could somehow figure out a way to incentivize the best and brightest people to go solve like these problems in healthcare, uh, versus just
Yeah,
throwing more tax credits to consumers?
I think it's a great, like, it takes faith. And this is something that I think is one of the temptations with when we think about solutions is sometimes we lose faith in the individual. You lose faith in like,
Uh-huh.
and this is like an actual principle I think that comes from God in creating us to be Like, we have intellect, we have our free will, and we have an ability to actually produce great things for other humans. We have to have faith in the individuals, because when you say incentives for people to create innovations and succeed, there is a problem with like capturing it at like some private equity or higher level. But it, on another level, it doesn't fully matter as long as like as long as the people receiving the care or the value are the ones that are dictating the market. It doesn't really matter who. So think about like Blockbuster. I'll go back to Blockbuster, Netflix. Like, Blockbuster had an opportunity to buy Netflix at one point. Now, I don't think if Blockbuster bought Netflix, they would just be able to like, let me buy Netflix and just kill a competitor, and let's go back to just like having rental like warehouses and stuff. Like, I think that they would have succeeded if they bought Netflix and then leaned into the innovation that people want, and then you'd still have streaming. So I think the issue there was that people wanted something that was a better value to them, or what they perceived, which was like streaming versus rentals and all that stuff, right? So there has to be a faith in the free market, that if we're on a scale of like what is free market versus not, it's all about patient engagement. It's all about Americans engaging in their healthcare. Are they exposed to the cost? Are they the actual purchasers of their care? Which is why this is why I bang on the Medicare drum, because you're not a purchaser of care in Medicare. Even in Medicare Advantage, it's just you're paying $0 for still a subsidized Medicare plan. So it's you're not purchasing Medicare, you're not purchasing Medicaid, you're not purchasing Obamacare, you're not purchasing employer-based care. So I would view it as like a scale when we think about what our solutions to this is. You can look at these big buckets of markets and start thinking about, okay, if the patient right now, if Americans right now are exposed to 20% of the cost, how do we get the steps to get them exposed to 100% of the cost? Because when the American is exposed to 100% of the cost, meaning they buy their premiums, they actually have to shop for care, they actually have to engage with the system. When you say how do we create incentives, Cameron, that is how the free market creates incentives, which is you're incentivized to innovate, to provide value to the family. And whether or not you get bought out, which I agree is like there could be a problem there. Like, the people are going to buy you out are still going to care that your product serves the person. But it takes that faith. We have lost faith because it's like we don't even know what innovation would bring in healthcare. And that's why it's so hard to have faith in the free market, because it's a human impulse to want to control. And it's easier to see the control through like, well, what if we put everybody under Medicare and we manage care this way? Or what if like I was in control of this and do that? And you really have to have faith in the complexity of the free market, that it truly is as simple as letting people be the ones that are in charge of what's valuable to them, and letting the innovation just happen and take you where it is. And so that's where, like in the employer market, when you talk about getting the HR out of being health insurers and getting families purchasing insurance, that is like 150 million Americans, a huge transformation. Medicare, we talked about it on our little podcast, Cameron. Like, you had the great concept of, well, what if you, instead of taxing you 3% and goes to the federal government and who knows what they do with it, what if instead like you're taxing it, reinvesting it in the free market, in the stock market, and then when you turn 65, you're reallocated your money back and you're starting to purchase insurance in a post 65 market like Obamacare. That was a genius idea. Those type of ideas they will upset every gorilla in the room, to, because you're breaking the status quo. But that's how you start to think. I think it's getting that scale from where we are now to how to get Americans 100% in control. That's like,
It
you just have
just
to trust. You have to have faith that will actually work.
And
well,
the
it
free
requires the
market,
innovator to build for the American versus building for the gorilla.
yeah, and the free market is the most equitable place or process in this. I think that's where. So if you are a secretary or the CEO in a Fortune 500 company, and you have your employer healthcare, you have access to the same providers, the same doctors. Like, literally, the janitor or the CEO has access to the same as long as you're on that same healthcare plan, you have access to the same technologies, the same everything equally. When you go to a single payer system, it's so we've got this like in Australia, you literally have you've got the public hospital, and then you've got the private hospital right beside it, right? And it's like, here, your procedure is going to be a year and a month from now at the public hospital, or you can pay $15,000 and we will put you on the schedule next week at the private hospital, right? So I think it's important that the free market that we have here in the United States, it's the most equitable. We just have to get it to work for the people, right? And give the power back to the people. And because, man, that the single payer thing it's rough, and it really does. I mean, the wealthier people that can afford it just remove their care. They go to direct primary care for their primary care stuff, and then they just write whatever check is necessary for the higher, and the better doctors leave, right? Because they can go to that cash pay, almost that capitalistic model in a single payer system, make more money for less cases, and you just really disrupt the care for everybody.
Daniel, I think you said,
Yeah.
I mean, one thing I just want to drill in, because Daniel, I think you said something really important, but also going to be really unpopular. So I want to like give you, I want to dial it in a little bit. So you said whether you're on Medicare, Obamacare, employer-sponsored coverage, you're not paying for your health insurance. And I think a lot of people would think, probably 50% of Americans are on employer-sponsored plans. I think probably a lot of our listeners would be on employer-sponsored plans. And my last job, I was on an employer-sponsored plan. I was paying $800 a month for my family of 5. So maybe just explain a little bit, like when you say employer-sponsored, if you're on an employer-sponsored plan, you're not paying for your coverage. And then I think, part and parcel to that is like, what would it mean? Like, how could you possibly advocate for people to bear the full brunt of that cost, especially in employer-sponsored plans?
Yeah, I mean, there's no such thing as a free lunch, right? So if your employer, so what I mean, to start the first question, what I mean is, like, on average, I don't know about, your specific employer for whoever's listening to this, but on average, employers cover about 80% of the premium cost for employer-based coverage, meaning like you only foot 20% of the bill. Now you might have paid a little bit higher percentage, but your law firm was probably footing, at least like 60% of the cost. So, they're paying for $2,000-$3,000 premiums, and you're paying like a portion of it. So depending on your employer, you might feel it a little bit more, but at the end of the day, like on average, they're covering 80% of the cost. So you're not exposed to it. But you are.
So pause right there. So that's true in my case, right? So I happen to know, like, I was like, the plan we signed up for premiums were like, over $2,000, because they've got this great plan that they, shopped to us. I'm paying $800 a month. That sounds like a lot to me, but when you look at the actual premium, it's like $2,000. So then from there, it's like, well, wait a second, Daniel, you're saying you would expect me to pay the full $2,000 a month when I could be paying $800 a month? That sounds
Yes.
unpopular. How do we get past that?
Yeah. So the portion that they were paying, so your employer is paying, whatever it is, they're paying $1,500, $2,000 for your insurance, right? So the concept is, instead of them paying for that for you on your behalf, they simply give you that money to go purchase your insurance, right? So right now, employers are tax advantaged to like cover employer sponsored care. So those are tax deductible. They don't have to pay taxes on what they fund there. And there's kind of this new wave and revolution in the employer coverage, and there's new rules that allow them to give you that money as a voucher, in a sense, that's also tax deductible. And now first of all, now you know what it cost. The Hogan family is like, okay, 800, you don't even know exactly unless you're like paying attention. But now if you're given, $2,500 or whatever it is to go purchase your insurance, and you have to go buy it in the market, you're at least exposed to the prices. And now you're starting to see,
Yeah.
okay, like, let me take my dollars. And now you're thinking about it, and
Well,
you're saying, well, I can get in California, I'll use the example of, I could get that Kaiser model for very cheap, but I'm stuck in the Kaiser system. Or I can pay for a Blue Cross plan that I can go see whatever doctor I want in a PPO, but that's going to cost way more. Or I can go to like this like really cheap narrow network like Health Net plan or whatever. And it allows you to think about, what do I value? Do I want to save money? And so that, just that alone shifts everything for half of Americans. But I think what it does more so is, like, we're in our 30s, Bob. If we had done this starting at age 22 and you do it all the way till you're age 65, where you purchase insurance year in, year out, you know exactly the costs. By the time you hit 65, if that was the status quo, you'd be like, hey, what the heck? Like, I have to give up my insurance that I've spent all this time valuing or whatever, and now I have to drop it to go on a government plan. You'd rebel against that. Whereas right now, it makes total sense. You're like, well, this is great. I used to have to pay $800 for some employer plan that they pick. Now I pay $0 and the federal government gives them to me. This is
Well,
wonderful.
and you're not, I've seen thousands of people make this transition to the individual plan. The thing that people take for granted and don't even realize is that, let's just take your example, Bob. If the premium is 2,000 and you're paying 800 of it, and they now give you $1,200 a month to go shop on your own, you're probably not going to pick the plan they had. They probably had a low deductible copay plan that your wife loves, because she's like, every time we go to the doctor, I pay my $10 copay. It's amazing. And the other $120 of that bill is being paid for by the insurance company, which your employer is paying $1,200 a month for. So, people they struggle to make that connection. But when you get the $1,200 a month, you can now go shop for, we go to the doctor 4 times a year. We don't need the copay plan. Like, we can go a higher deductible. We can pay for some of these services out of pocket. And when you make that decision, then you start shopping for your services. And that's what, and you kind of start shifting the utilization of your health insurance to be more for what insurance is intended to be, that catastrophic loss, versus this plan that just pays for, me to go get my, blood pressure checked. And so, those are things that you can do yourself or pay for out of pocket. And, if you look at an employer group, probably 80% of the group, 70% of the group doesn't need that copay plan. Like, they're not using the healthcare the way that the other, unhealthy portion of the group is, that does need a lower deductible copay plan because they have a lot of healthcare risks. Those are the things that the shift, from a one size fits all plan to letting employees go shop on their own. I think, that's like you can play that out, right? Like, okay, if we now have millions of Americans going and shopping on their own, and now millions of Americans, you know, shopping for the actual provider on their own because they want the cheapest provider because they don't really care about the quality of care, or vice versa, right? Then, the free market starts to correct, hopefully.
And use
I
math.
guess would be the solution here. Yeah, it's
Yeah,
just
man.
math.
it's just math. This is the
But
whole.
you,
We brought
but
it all
this
the way
is,
back. It's just
and
math.
you can't do, and you can't do the math if you don't have exposure to all the numbers, right? So if you've got that exposure to the cost, you could become you understand the math better. You become a more informed consumer. You can consume healthcare more wisely. You're more incentivized to shop, right? And to demand that pricing transparency that's completely lacking in the system. So I think it's a big component to unlocking some of this.
And people, if they have the tools, I mean, I can't tell you how many customers and people I've served where I'm like, listen, your gut is you already know it. You just need permission to follow what your gut's telling you, right? Like someone like that, we have $2,000 and you $24,000 a year, and your gut says there is no way we're consuming that much. We're not even consuming like a quarter of that a year, or a sixth of that. It's like, you just need permission to follow your gut, right? And here, give me that $24,000 and let me go do what's best for our family. It's just math,
Yeah.
baby. It's math.
That's
I
our
just
real
talked
mission.
I just spoke with a really guy that, makes great income, paying $37,000 a year for him and his family to have insurance. And he's like, I did the math. He's like, I probably should just self-insure. He's like, it makes more sense.
I'll put
Because
it
I
to
think
you.
it makes more sense for me to self-insure.
I said we wouldn't do this on a health hack, but just it is not. I have in the past full stem cell transplants for $60,000 to $75,000, all in. Stem cell transplants, knee replacements, $15,000. Large spine surgeries, anywhere from like $10,000 to $20,000. People would be shocked. And you say like a stem cell, let's just say a stem cell transplant to that gentleman, $100,000. I mean, that's leukemia, lymphoma, like worst case scenario, right? It's $100,000 exposure to him. That's a lot of money for sure. But when you get into these big things, if people actually understood how far $24,000 or $20,000 would go in the healthcare space, you'd be mind boggled if you were a consumer of healthcare, right? Now we're going to help you do that here at Presidio, right? We're not going to let you just go flail on your own. But if people really knew, but again, back to Bob, transparency exposes the king, right? It exposes the all of those weak pieces that the gorillas don't want you to see, right? And so it's a murky, confusing, opaque process for a reason, because information and
Yeah.
transparency is power for the people.
And what price transparency is, some of the states have passed different legislation, but what the price transparency is today in its current form is there's a big filter on that transparent, film, right? Like it's pretty opaque, transparency. It's still got a lot of, dirt on the window that needs cleaned off. Uh, but yeah,
How they do a lot of that is they'll do, so a specific procedure is multiple codes, right? So
yep.
to put the jigsaw puzzle together as the consumer, you have to know all of the codes and all of the pieces that are going to be. And so, yeah, like this one little thing only costs this, but unfortunately to get your procedure, you're going to need these 10 other things to go with it. And that's where it's, and then the other thing, Daniel, like the charge masters, they'll give you price transparency for the charge master, but then they will not give you any sort of discounting, right? Like they won't tell you what the discount, they won't tell you what the commercial insurance discount is. And so it's like $100,000. You're like, well, that's a ton of money. Well, there you got to apply it. You need the secret of the decoder ring to get
It's a $20 burger.
It's a $20 burger.
Yeah, we should do a show and just break down my bills from a recent colonoscopy, which should be like the most straightforward like bill of all, and is not. I mean, there's like a facility, then there's like another facility because the facility rents from that facility. Then there's like a nurse, and there's an anesthesiology fee for the nurse anesthetist, and then there's an anesthesiologist who oversees the nurse, and there's a couple $100 for that. Like just to like, take some pictures, it's just crazy that,
The
like
pictures of
there's
Cameron's
5 or 6.
colonoscopy will not be part of the episode.
Yeah,
Some new socials, some new social pictures, right?
there's a separate website for that probably, but anyways, we'll yeah, it's just math, and we want to continue to dive into some of these topics. But if you're still listening, like Alex always says, we're glad you made it this far. But yeah, we're excited about some of the changes that can be made here, and we're gonna give you some time back. We won't go to the full 2-hour mark. We'll end this at over an hour. Appreciate you guys joining us for Know Thy Health, and we'll see you next time.